Hi friends, my name is Jessica Mark and I'm an Ortho-Bionomy instructor in Asheville, North Carolina. I'd love to share with you today a self-care tip for the patella, or the kneecap. This is a great way to try to release, a general release for the knee before you start working on maybe some of the knee points or some of the more intrinsic muscles of the knee. Sometimes it can be the clearing way to actually alleviate some issues of imbalance in the knee altogether. So it's a great way to start before you work further in the knee. So one way to do that is to sit. You can also, with your knee in front, with your leg in front of you, you can also sit in a chair with your knee slightly extended out in front of you. So that's another great option. Sometimes people need a little support under their knee, so you may want to use a pillow if you're sitting, just to have a little bit of support underneath. However, sometimes if it's too bent, you're not going to get much movement in the kneecap. So you want to make sure that the knee is comfortable. For me, it feels fine for this leg to be extended, and other people may want a little support under there. So what we're basically going to do with the kneecap is notice its range of motion. We're going to take it inferior and superior. We're going to take it medial and lateral, and we're going to twist as well, and maybe even have a little bit of ruddering or seesaw movement. And then notice if it likes compression in any of those directions. So I'll start just by moving the kneecap, gliding it. I'm just using my fingers here as a little guide, up and down. And so I'll move it down towards my feet and then up towards my hip. And I'll notice which direction the kneecap glides easiest. Remember, we're going to go towards the ease. Away from pain, towards ease and comfort is our principle. And so I'm noticing that my kneecap likes a little bit more that inferior or towards my feet direction. So I'm going to go with the kneecap in that direction. Then I'm going to use my pointer finger, or maybe even my first two fingers, to add the compression straight down. So that I'm coming in the middle of the kneecap and pushing straight down towards the table. So here I got it in that push down position. I'm going to use my top finger to have a little bit of compression straight down on the kneecap. And then I'm noticing that my kneecap wants to come out of that. And so I'm gently going to release the compression, allow a couple of seconds to kind of let that ripple out. And then I'll recheck the directions. Did I do anything? I don't know. Let's try. So now I've got the inferior and superior directions, and I'm noticing a lot more movement and a lot more glide in the knee. And now I'll check a little bit medial and lateral. So again, just using my fingers gently on the sides of the kneecap, pressing it medially and laterally. And notice it definitely goes more to the medial direction. So I'll hold the medial direction. I'll take my opposite hand, place two fingers right on top of the kneecap, and gently press straight down. And what I'm doing in this pause is really listening for my self-corrective reflex to come online. And there it goes. Woof. It's just a little reflexive movement that kind of tells me I want to come out of it. I'm ready to be done. And then I'll recheck that glide, and again, a lot more mobility now in the lateral and medial. The other thing I notice is that the direction comes more tone. There's more fullness and more balance between the two directions, as opposed to way gliding this way and not so much glide the other way. Of course, you can do this on the diagonals as well. That's also fun to play with the directions. The other thing I'm going to do now is treat the kneecap as a doorknob and notice if it wants to twist in the counterclockwise direction or the clockwise direction. So I'm going to pincer grasp the kneecap, and I'm going to rotate it counterclockwise and then rotate it clockwise. Both of those feel pretty even to me. There's not a whole lot of preference there, but I guess if I had to pick, it would probably be counterclockwise. So here I go, going into counterclockwise. I'm going to use my opposite hand to push straight down on the kneecap. Might just take a deep breath, pause. There we go. So I'm actually noticing it feels like it goes more into the counterclockwise before it's coming out and spiraling back in the clockwise direction. That was interesting. And then I'll just recheck. Yeah, so now I have a lot more. Feels like a little roller coaster ride, whee, in the clockwise direction. So you can also do the same thing, teeter-totter. Some people really may feel that movement. If you feel no movement at all, Sometimes people like just compression straight on the knee. If it's not moving, then we're going to meet it where it is and just gently push straight down. Again, with one hand or two, gentle pressure. Wait for any self-correction reflex to happen, and then kind of recheck and notice if there's any more range in that kneecap. So then, after you've done that, the best is give it a little flexion and extension, stand up, and then walk around your room and see if you can notice a difference between the two sides. I hope you will. Thanks, y'all.